Hi, I'm Dr. Hawks. I'm an orthopedic surgeon at Salina Regional Health Center. Today, we're going to be talking about degenerative joint disease, or osteoarthritis, joint replacement surgery, and an exciting new technology called the Mako robotic arm. The topics are joint pain. We'll talk about common causes of hip and knee pain, the treatment options of hip and knee pain, and also joint replacement surgery, how it works and what are the parts. And then we'll talk about the Mako robotic arm assisted surgery. Your joints are involved in almost every activity you do, whether it's from walking or moving or working, and a disease in one of these joints can limit your ability to move and to work. Joint degradation can be a pain that's constant or comes and goes. Also can occur with movement or a period of sitting for a period of time, like working or sitting in a car. It can be located in one spot or it can radiate to a separate spot in your body. A common cause of joint pain is osteoarthritis. It's also called degenerative arthritis or degenerative joint disease because it's a wearing out condition of the cartilage of your joints. It's something that's very common. Over 30 million Americans are affected by osteoarthritis. Another type of arthritis is called rheumatoid arthritis. It's an autoimmune disease. That means your immune system attacks your joints, causing it to break down and causing pain and a loss of cartilage. It's more common in women. It's in a younger age, but men can get it later in life. How do we know you have arthritis or degenerative joint disease? Well, let's take a look at healthy versus arthritic knees. When we look at a healthy knee, you can see the white shiny surface on the knee, and this is called articular cartilage. This articular cartilage provides a smooth gliding surface of your knee. Your meniscus, which is a padding in between this cartilage, protects the cartilage. As the meniscus and the cartilage breaks down, it exposes the bone underneath. This causes pain and swelling. We know this by looking at the x-rays of your knee. And when we look at a more normal x-ray, you can see that this is the femur or the thigh bone, the tibia or the shin bone, and in between you can see a space. This space is not filled with air, but filled with cartilage and the meniscus. And over time, you can get a breakdown of this cartilage and meniscus where you can see extra bone growth called osteophytes, sclerosis of the bone, and you can get a closeness of the bone where you get bone on bone arthritis, where those bones are rubbing on each other, causing pain and discomfort. Similarly, in the pelvis, you can see that you have a pelvic bone that has a cup called the acetabulum and a ball called the femoral head, and that goes down to your thigh bone or your femur. On the ends of these bones is that slick, shiny surface called articular cartilage. As that cartilage breaks down, it exposes the bone underneath. It causes decreased range of motion and difficulty with your activities of daily life. Here's some x-rays of a hip. Here's the ball and here's the cup. You can see the joint spaces are well maintained. But over on this side, you can see where that joint has started to break down. You can see that increased whitening called sclerosis, joint space narrowing, and in this case, these large cysts underneath the bone caused by the arthritis. You can also get post-traumatic arthritis, where you have an injury like an ACL tear or a car crash that can damage the cartilage inside your knee and can cause pain. It cannot heal properly and can accelerate quite quickly after an injury. Hip pain. Usually hip pain or osteoarthritis for the hip is usually in the groin or the buttocks, but it can be in the lower back. It's not always. Some people say, I don't always feel pain. Is that normal? Yeah, that can be the case. It can come and go. As your activity increases, you could have more pain. And why does my hip pain wake me up at night? Well, hip pain can wake you up at night because you're more sedentary thinking about your hip pain, or you could have been very busy that day, resulting in increased pain. For knee pain, can pain in my knee cause pain in another joint or my back? Absolutely. The human body is a well-oiled machine, and when you have a breakdown in one part of the machine, another part of that machine is affected. And why does knee pain wake me up? Yeah, when you're sitting in bed thinking about it, sometimes that inflammation can cause some pain. We always start with non-surgical treatments for knee pain. And a big part of that is your diet and exercise. Losing weight can really take a lot of pressure off your knee. For every 1 pound you lose, 4 pounds of pressure off of your knee. Walking aids like a cane or a walker can help. They can improve your gait pattern, which can also lead to decreased inflammation within your knee and less pain. Heat or cold can also be very effective in treating arthritis. Sometimes we'll send you to physical therapy. We can strengthen the muscles and increase range of motion. All of these things can decrease your pain and increase your function in your knee without surgery. We normally prescribe non-steroidal anti-inflammatory medications like Aleve or Motrin. These medications can decrease inflammation within the joint and can lead to less pain. Sometimes we will recommend cortisone injections. These injections can be very effective, but over a period of time can be less and less effective due to increasing arthritis. When to consider a joint replacement? If you've noticed that you've had increased pain or these conservative treatment options are not working for you. Are you less active? Does your joint pain keep you from doing things you want to do? Is your quality of life diminished? Is your joint pain affecting your ability to walk up and down stairs? Is your joint pain affecting your ability to get a good night's sleep? For some of these reasons, I would consider a joint replacement. Let's talk about hip replacement. A total hip replacement involves removing the arthritic bone and replacing it with metal and plastic. There's more than 300,000 hip replacements performed each year in the United States. How does that work? A replaced hip is taking and replacing the cup by hollowing out the pelvic bone and putting a metal cup in there. We then take a metal stem that goes inside the bone and replace a ball and a piece of plastic that acts as a bearing surface. Here's a short video that demonstrates that. As we strip away the skin and the muscles, you can see the arthritic hip. We cut out the arthritis and hollow out the pelvic bone. A cup is placed within the pelvic bone. This bearing surface or this plastic liner is placed. And then we put a stem down the femur bone. And then we put the hip back together. This provides a smooth gliding surface and a removal of the rough articular surface. Let's talk about knee replacement. I feel very strongly about only replacing the part of the knee that needs to be replaced, whether it's a partial, a two-stage, or a total knee replacement. In a partial knee replacement, we usually only replace the parts of the knee that are damaged, which may help to minimize trauma to the healthy bone and tissue. With a total knee replacement, it's a complete resurfacing of the knee, where we're changing the surfaces of both the femur and the tibia on both sides, and often the kneecap. Here's a video of a partial knee replacement. You can see the diseased area on the inside part of this knee, where the cartilage is decreased. We remove those sections, and we place a metal cap that resurfaces the femur bone, and then we put another metal part that goes over the tibia or the shin bone and a plastic bearing that goes in between there. There's all kinds of partial knee replacements. There's unicondylar, where we can place the inside or the outside. The patellofemoral, where we just replace the part that works with the kneecap. And a bicompartmental, where we'll place the inside and outside and the patellofemoral joint. Let's talk about total knee replacement. Over 700,000 total knee replacements. That's a lot of knee replacements to be done in the United States. It's a very common procedure. Here's a video of how a total knee replacement works. Strip away the skin and the muscle, and you can see the diseased portion of the knee. We cut the knee, taking away all of the arthritic parts. We put a cap over the femur bone, and a metal stem that goes into the bone, insert in between the knee. This provides a smooth surface for the knee to articulate, taking away that bumpy surface. Let's talk about common questions about joint replacement. Can I have an allergic reaction to the implant? The answer to that is yes. If you have a severe allergy to metal on your skin, it's something you're going to want to talk to your surgeon before undergoing a joint replacement surgery. The nickel and some of the implants can really cause a problem for people with severe metal allergies. Will it set off a metal detector? Yes, the implant will set off a metal detector, but a lot of the TSA agents have seen this. Like I said, over 700,000 knee replacements are done. It's something they're very familiar with. We also can give you a card that you can keep with you that identifies the implant and your total knee replacement. Is the implant heavy? Not really. It weighs less than a pound, but we are removing some bone. So don't really get a lot of questions of people saying that it's very heavy. Now I'd like to talk about a new technology that's transforming joint replacement in Salina. It's called the Mako robotic assisted technology. It helps surgeons provide patients with more personalized surgical experience. It also keeps me from getting into trouble where I shouldn't be in your knee. The Mako system is used by surgeons to perform total hips, partial knees, and total knee replacements. Laboratory studies show that it demonstrates better soft tissue protection. That means limiting the damage around the knee. And in my mind, that can lead to less pain after surgery if we're not damaging the soft tissue around the knee. Also in laboratory studies, it showed that in total hip and partial knee replacements, it demonstrated more accurate placement of the implants inside the person's body. That means less mistakes. Here's a quick quiz. What are these images below? If you answered a CT scan, you're correct. On the left side of the screen, you can see a CT of a knee, and on the right side of the screen, it's a CT of the pelvis. Now, that's the first step in your Mako joint replacement is we get a CT scan to make a three-dimensional model of your body. Where are those extra bone growths? Where are you having those cystic changes within your hip? And before surgery, we use that 3D model and it loads up to a software that we're able to make a plan before we even get to the surgery. So my dad always used to say, failing to plan is planning to fail. So we always we can see, where is the implant going to fit best? What's the size? How much bone do we need to take? All these things can allow us to make a better plan for when you're in surgery. And that way we can minimize error and improve the functional outcome of your joint replacement. So here's the CT scan. It goes into a 3D model. We then size the implants, which you see in green, and in a partial, you can see we're in green, and we can make sure the curvature matches. We can also see how much bone we're going to cut and what our plan is. Very similar to the knee and the hip. You can see we say the CT of the hip. We then put it into the computer, and then we draw out the surgery. How much leg length are we going to change? How much offset are we going to be? Meaning, how far are we going to be from the center line? We also can put the cup deeper or shallower depending on your bone quality. All these things are important to make sure we don't have any errors in the OR. In the OR, we take that plan and we load it into the computer. We then perform the surgery and we match your bone that's sitting on the operating table to the three-dimensional model in the computer. And then we allow the computer to help us execute that plan. I tell patients that it's like having a coloring book, but not being able to color outside the lines. I can draw a line like you see in green, and I can say, I don't want to go in these areas. And I cannot push the saw past those areas. Now, this allows me to limit the soft tissue damage on the inside, outside, and back part of the knee. That keeps me out of trouble because you have a lot of blood vessels and things that I don't want to hit with a saw in the back part of your knee. Here's some x-rays of some joint replacement done here in Salina. This is a total hip here, a partial knee replacement, and a total knee replacement. We get several x-rays of these over a period of time, up to a year after surgery, depending on how well you're doing. We want to make sure that the implant isn't slipping. We want to make sure that the bone isn't being resorbed around this implant. And we definitely want to make sure that there's no signs of infection. I use a Mako Triathlon knee. Now this is a great knee. It's not the newest technology, but it's tried and true. It's not the oldest technology either. It has a single radius that allows for your knee to flex on the same circle, potentially requiring less effort from your quadriceps muscle. It's been done a lot. Over 2 million triathlons have been put in since 2004. I think it's a great product, and it's something that I've used over the last 6 or 7 years. How long has the Mako procedure been available? Well, the first Mako procedure was performed in 2006, and I trained down in South Florida, and it was big news down there. Over 80,000 hip and knee replacements have been performed worldwide. And a new statistic, over 50% of all that triathlon knees are put in with a robot now. I just feel this is the way things are going to go in the future. Common questions. Does the Mako robotic arm perform the surgery? The robotic arm doesn't perform the surgery, nor can it make any decisions on its own without the movement of the surgeon. I set the plan, I push the button, I move the robotic arm. It just prevents me from getting into trouble. It also helps me make sawbone cuts more precisely than I could with my human eye. Recovery. After surgery, your surgeon, nurses, physical therapists will set goals with you to help you get back onto the move. That's almost as important or more important than the surgery itself. Individual results vary. Not all patients will have the same postoperative recovery or activity level. Sometimes people have pain even after the joint replacement surgery. It's important to remember that joint replacement will not allow you to do more than you could do before joint problems developed. Just like I said, activities such as golfing, doubles tennis, skiing, these are all good activities. Dunking basketball and running marathons, I think, are less likely after a joint replacement. Like I said, walking, biking, swimming, or other low impact activities are something that you should be shooting for after your joint replacement surgery. Most people return to driving in about 4 to 6 weeks. This can vary. Sometimes it takes a little bit longer depending if you have any problems like a postoperative infection or excessive pain that doesn't allow you to drive. I find that people with their left leg tend to drive a little bit earlier than people with their right leg if they're having the knee surgery on the right. Thank you. This concludes our lecture on joint replacement and on the Mako robotic assisted surgery. If you have any questions, please feel to comment or to get a hold of me at my office at Salina Regional Orthopedic Center.
Thank you for choosing Salina Regional Orthopedic and Sports Medicine Clinic for your joint replacement procedure. We're excited about eliminating the pain that has restricted your freedom of movement and helping you return to a fuller, healthier, and more active life. We strongly believe in partnerships with our patients, which is why we focus on education about your condition and treatment options. This video will help you understand what to expect in the coming weeks and how to best prepare for and recover from surgery. First, you can rest assured that you've come to the right place. Salina Regional Orthopedic and Sports Medicine Clinic is part of Salina Regional Health Center, which offers the region's most advanced surgical technology, along with comprehensive therapeutic resources. Helping you return to a more active lifestyle is a true team effort, and you can count on our experienced team of orthopedic professionals to provide treatment that works best for you. Each member of our team is totally dedicated to your successful surgery and recovery. Find a joint coach. A joint coach is a family member, friend, or caregiver whom you choose to help guide you through the joint replacement process. Among other things, your joint coach will accompany you to doctor appointments to become familiar with the process and expectations of your care team. You need to be in good health before surgery, so it's important to visit your primary care physician for a physical 30 days before surgery to ensure that your heart, lungs, and other vital systems are healthy enough to undergo surgery. Another provider to see before surgery is your dentist. Healthy teeth and good oral hygiene lower your risk of infection after surgery. And if you smoke, quitting now will help your body recover faster and also help prevent infections. As you can see, surgery requires a lot of physical preparation, but it's just as important to be mentally prepared, which is why we highly recommend our Joint Academy education class. Directed by our Orthopedic Care Team, this free class is tailored to those who are scheduled for joint replacement surgery or are considering it. You can learn more about your replacement joint, what to expect during surgery and recovery, and the process of returning to an active life, including the type of home medical equipment that can help you do so. The Joint Academy is a great way to get answers to all the questions both you and your joint coach have. 2 to 4 weeks before your surgery, you'll need to meet with pre-admission services personnel at Salina Regional Health Center. As always, your joint coach is encouraged to attend with you. The pre-admission services staff will evaluate you for surgery, and a care manager will begin your plan for recovery. There will be a health review to discuss your medical history and go over your current medications. You'll also receive a special soap to shower with before surgery to help prevent infection. An important part of your pre-admission meeting is a visit with a care manager who will discuss the things you'll need after surgery, which can include medical equipment, rehab services, and home health or skilled nursing arrangements. Be sure to verify with your insurance company how much of your surgery is covered and what your financial responsibility will be. Salina Regional will ask for your copay, deductibles, and/or coinsurances the day you arrive for surgery. In the weeks leading up to surgery, there are exercises your physician and care team can recommend that will help you build muscle strength, which will improve your chances for a more rapid recovery. It pays to plan ahead and properly prepare your home for your return from surgery. Loose rugs, electric cords, and other small objects can be a tripping hazard, so take time to clear walkways around your house. Make sure all paths you take have ample lighting and install night lights if needed. Put your phone charger, remote control, facial tissues, wastebasket, and other necessities within easy reach. This includes moving food, dishes, and clothing to be accessible between knee and chest level. Prepare meals in advance. Having a variety of easy-to-eat meals ready to warm up can greatly simplify mealtime. If you have pets that demand a lot of attention, plan to have them spend more time outside or consider finding a good kennel or having a family member or neighbor pet sit until you've fully recovered. Successful recuperation from joint replacement surgery begins with getting your body moving soon after surgery to improve breathing, blood flow, and digestion. Movement reduces the risks of developing pneumonia and blood clots. If your surgery is in the morning, you can expect a physical therapist to see you in the afternoon to help you get out of bed, sit in a chair, and then walk around the unit. Strengthening exercises start the day after surgery in the morning and afternoon with the assistance of your physical therapist or nurse. You'll be able to take part in group physical therapy where you can interact with other joint replacement patients. Pain is different for each patient. Your care team will work with you to provide the safest, most effective pain relief. Both medication and non-medication treatments are available for relieving pain. Our goal is to keep you moving forward and get you back to an active lifestyle as soon as possible. When you are discharged, you will return home with a recovery plan prepared exclusively for you by your care team, including a plan for managing your pain and physical therapy. Following each step of your care team's plan will help you make a full recovery in the least amount of time. Continue strengthening your new joint at home by performing the therapies you've learned or by attending outpatient therapy. To reduce your risk of infection, be diligent about washing your hands, especially after touching pets or animals. Take your pain medicine only as prescribed. As your pain decreases, cut back on your medicine and try managing pain in other ways, such as increasing your movement and activity, applying an ice pack to the swollen area, and elevating the incision area to improve blood flow and reduce swelling. It is common to have some swelling after surgery and activity, but do not put any ointments, creams, or lotions on your incision unless told to do so. Follow the instructions on how to shower with your incision. Do not submerge your incision in a tub or any type of water until your surgeon tells you it is safe. There are other things you can do to make your days following surgery more comfortable and productive. Wearing shoes with support will help prevent slips and falls. Avoid wearing flip-flops or other backless or toeless shoes. When you move from a sitting to a standing position, move slowly to avoid feeling faint. Changing positions often or going for short walks will improve your circulation and reduce stiffness. Do not lift heavy objects and avoid sitting in low places, which can make getting up more difficult. Use whatever assistive devices your therapist or surgeon has recommended. Finally, it is important to go to all of your healthcare appointments, beginning with the first follow-up appointment with your surgeon. You will need to see your surgeon 1 week after surgery and then again about 4 to 6 weeks later. At these appointments, your surgeon will perform a physical exam and take x-rays, discuss the progress of your treatment plan, which will include an assessment of your medicines, pain management, and exercise plans, and talk about the next steps of your recovery. You and your surgeon can use this time to discuss when you can begin resuming your normal routine. With surgery and therapy behind you, now it's time to enjoy a new lease on life with your new joint. Make a commitment to maintaining your new joint and your body by focusing on healthy living. Exercise to keep your joints strong. Once your surgeon says it's okay, exercise 3 to 4 times a week for 20 to 30 minutes at a time. Manage your weight by eating a balanced and healthy diet. With a healthy weight, you can pursue an active lifestyle with your new joint and keep moving forward for years to come. Regular checkups with your primary care physician will help you manage or improve blood pressure, blood glucose, cholesterol, and weight. If you quit smoking before your surgery, maintain your commitment to staying smoke-free. Your new joint is the beginning of a new, healthier you. Finally, if you plan any surgery or dental work, be sure to tell your doctor or dentist about your joint replacement. An antibiotic treatment may be required before surgery. Thank you for moving forward with us, Salina Regional Orthopedic and Sports Medicine Clinic. We look forward to being part of your journey. If you have any questions about the joint replacement process, please contact us.